According to Doña County Detention Center Director Chris Barela, he estimates that around 33 to 57% of people in the detention center are suffering from some form of mental illness. He says a lack of mental health resources leads many to end up behind bars.
What we find is that the people that are coming into the jail are coming in a such disorganized, chaotic way that we have to stabilize them and get them back to a stability point. That's occurring because outside of the jail, before they get to us, they're not receiving the services, or they're not attending the services, or they're not staying on their meds the way they're supposed to.
Major Brent Barlow with the Doña County Sheriff's Department says all officers are trained to handle people with mental illness, but it's not always easy to determine if someone needs to be taken to the hospital or the detention center.
It's kind of a case-by-case issue. Sometimes it's very easy to discern that someone is suffering from a serious mental health issue. Like Las Cruces Police Department, we put our deputies through training in Basic Academy about how to identify people suffering from different levels of mental illness, as well as how to respond and hopefully de-escalate those. But it really depends on what the person's behaviors are at the time.
Ron Gurley with the National Alliance for Mental Illness in Doña County has worked with law enforcement to help train officers. He says local law enforcement does the best they can.
They very seriously do train their officers, and we help with the training as well. Officers can be trained to react to the mentally ill. That doesn't mean they're always going to do that the way they're trained, but we do have, I would put us up against anybody in the country right now in terms of the numbers of officers that are officially trained.
When officers bring someone suffering with a mental illness to the hospital, they could wait in the emergency room for up to 16 hours with the person before they are able to see a doctor. And patients that are told they need to be admitted by the courts have to be taken all the way to Las Vegas, New Mexico, where the only state mental health facility is located. Ron Gurley says there are not enough beds in the state to address New Mexico's mental health needs.
We need to increase our bed space at Las Vegas by 200 at least. We need a 100-bed facility here, either to buy a hospital or rent a hospital, a public bed versus a private bed, and we don't have those.
Dr. Wayne Lindstrom, director of the Behavioral Health Services Division of the Department of Health and Human Services, says that more bed space isn't always the best option. He says he is hoping to increase the number of crisis triage and stabilization centers in the state to help people before they get to the point of hospitalization.
That's going to be a place where the police or family members or individuals can walk in and be assessed and be able to stay for 3 to 7 days time and hopefully be stabilized and then be stepped down to an appropriate service level in the community.
Doña County's Crisis Triage Center has been built for close to 2 years, but it's not operational because of a lack of funding and a medical group to run the facility. Lindstrom says he is trying to make it easier for these facilities to receive funding.
The answer to that's really going to be through Medicaid. So we're working with the Centers for Medicaid and Medicare around making this a Medicaid-covered service, and also working with the Department of Health around establishing licensing standards for this level of service. So the kind of challenges that you've had in Doña County with opening the triage center, once we have this built into the Medicaid benefit, will cease being a problem.
Until more resources are allocated toward mental health, many will continue to end up behind bars. For KRWG, I'm Samantha Sonner.